you?
Good. How you doing?
I'm so honored to be speaking with you today.
Oh, thank you very much.
No,
Appreciate the opportunity.
your work is amazing. Dr. Perry is a senior fellow of the Child Trauma Academy, which I think is an amazing organization, by the way.
Thank you.
Of practice based in Houston, Texas, a professor adjunct in the departments of psychiatry and behavioral sciences at the Feinberg School of Medicine, at Northwestern University in Chicago, and the School of Allied Health, College of Science, Health and Engineering, La Trobe University, Melbourne, Victoria, Australia. Dr. Perry is the author with Maya Salovitz, is that correct? Of The Boy Who Was Raised as a Dog, a best-selling book based on his work with maltreated children and Born for Love, Why Empathy is Essential and Endangered. His most recent multimedia book, Breathe, Reflections on Childhood Trauma in Society, was released in 2013. Over the last 13 years, Dr. Perry has been an active teacher, clinician, and researcher in children's mental health and the neurosciences, holding a variety of academic positions. Dr. Perry has been consulted on many high-profile incidents involving traumatized children, including the Columbine, Colorado school shootings, the Oklahoma City bombing, and the Branch Davidian siege. His clinical research and practice focuses on traumatized children, examining the long-term effects of trauma in children, adolescents, and adults. Dr. Perry's work has been instrumental in describing how traumatic events in childhood change the biology of the brain. The author of more than 200 journal articles, book chapters, and scientific proceedings, and is the recipient of a variety of professional awards. Thank you so much for being here.
It's my pleasure. My pleasure.
Is there anything you'd like to add? Did I miss anything? I'm sure I have.
No, it's plenty.
Yeah. So, like I said earlier, I think that your work is amazing. And what I love is that you have the research and the science to back up the idea that what happens early on in life has long-lasting effects on the biology of the brain. So, would you mind defining what is trauma?
Well, it's, as I'm sure you have run into in your reading about trauma. Trauma is the word trauma is something that we all use in one way or another, but I think many people kind of have a different idea of what trauma is. The field itself has actually struggled with what trauma is, and so over the years, probably the best sort of articulation of trauma has come from SAMHSA, where they've sort of tried to help people think about trauma as three things. That there's sort of the the event. Mm-hmm. So let's say the event is something like witnessing domestic abuse. Mm-hmm. And you can use the label and say that was a traumatic event. But the interesting thing from a neuroscience perspective is the second component that SAMHSA wants people to think about is the experience that the person who's in that event has. Mm-hmm. And not everybody will have the same experience. Depending upon your state of awareness, your age, mm-hmm. your previous history, the way you interpret that experience, that event, is going to influence whether you are overwhelmed or whether you have some context for this or whether you actually aren't actually, if you will, dysregulated. And then the third part that's really important is, the sort of the long-term consequences of the experience that took place in the event, and that's the effects. Mm-hmm. So the 3E perspective, there's the event, the experience, and the effects. And from a neurodevelopmental perspective and a neurobiological perspective, what's really important is really the experience and what happens to that individual's stress response systems in the moment and over time, which will then influence how their brain changes, if at all, mm-hmm. and then that is really what underlies the effects. So it's interesting. Many people who are listening probably know children who have autism, for example. Mm-hmm. And a child who has autism has typically a very difficult time with changes in their environment. And so very minor changes in the sensory environment can be overwhelming and traumatic for a child who has autism.
Right.
Whereas a person who has lots of experience and has been in multiple firefights and has survived those and actually gets into in combat and is ambushed, that individual may not even have a huge activation of their stress response. And so if you look at those two different events, one event is making a minor change in the room of a child.
Right.
The other experience is sort of being literally in the midst of a life-threatening attack. You can have completely different outcomes depending upon how you are put together and how your brain and body respond to that experience. Now, the reason this is important is that it turns out that, as you were talking about earlier, that there's a whole range of relatively subtle interpersonal experiences that you can have as a young child that from a distance don't look like they're traumatic.
Right.
But in fact, from the experience of a young child feeling their parent withdraw affection or their parent humiliate them or their parent degrade them, that can have the same physiological impact as a big T trauma that anybody would look at and go, wow, that was a bad thing. And so again, one of the characteristics of developmental trauma is that it confuses the traditional mental health perspective. And so if somebody was taking a history of you, for example, they might say, oh, well, she did have a few bad things, but there was, she should be fine, which is a very common perspective when people don't see huge, big T traumas that you experienced. They go, well, that happened to your mom. That happened to your dad. And I think that sort of minimizes the potential impact that these kinds of things can have transgenerationally and minimizes the impact of things like food insecurity, housing insecurity, a parent stressed and distressed about unemployment. Those things impact the brain of the child living in that environment. And I would argue, and I'm sure there'll have to be some more research on this, but I would argue that more children in our schools are experiencing trauma-related symptoms from chaos, from unpredictability, from these poverty, from racial marginalization, from bullying, than there are kids that are experiencing symptoms from big T trauma. And it's something that we have to better address.
I totally agree with you. And I think that the conversation that we're having is huge, because if parents can't recognize a trauma in themselves, then they're not going to recognize it in their child. So if, for instance, my parents never valued the fact that they grew up, impoverished, that suicide affected them, that they weren't attuned to their parents or the parents weren't attuned to them, if there's no recognition by my parents that that was traumatic, then my parents themselves, no fault to them, but they can't recognize that not attuning themselves to their children or pushing their children away or humiliating them means anything. It's not a big deal because you have a house and I go to work every day.
Right.
So I think it's a really important discussion that we're having, because I think lots of times it's the parents who don't recognize perhaps in themselves, hey, what has happened to me? And what might I not be understanding about myself and what has affected me? And if I can't recognize it in myself, then I can't recognize what my child might need that I might be missing.
Right. The whole phenomenon of that we tend to parent the way we were parented is, it's a gift of our species that we actually are able to sort of absorb what we're exposed to and then pass it on. And that's a gift because we have a lot of good things that we can pass on, like learning, like reading and language and all kinds of stuff that are really very complex. But we also pass on things that are not so good. And as you say, one of the most interesting things about any human being is that we frequently don't understand how we come across,
right,
or how we are being experienced by others, unless we are kind of reflective, and unless we are, as you say, very attuned. So one of the, I see it all the time, and I'm sure you do too. You go out into the community and you see like a really busy parent, and they're focusing on their phone, and you see their child look up at them and try to engage them, and then kind of look away just with this sort of, I don't want to say heartbroken, but it's sort of just this sort of disengagement that's demoralizing. They're kind of demoralized. They try to engage their parent, and the parent just is present, but the child feels dismissed. And, I think all of us have had that same experience, right? You'd be with a friend or a colleague or somebody and you think that they're present with you, and then they'll go, oh, just a minute, and they'll get their phone out and they'll say, I got to answer this. And you just feel dismissed. But, think how you feel as an adult when that happens. Just imagine what that feels like if the most important person in your world does that to you. It definitely has impact.
Yeah, I think, and this is why I love self-study and I love teaching, self-reflection, because we have to understand what happened to us, and we've got to really, really look at our experiences and understand the self, so that we can check ourselves and change in us in terms of parenting, so we don't pass it along. And I think that, in lots of cases, including my parents, because they were working parents, because they provided what they didn't have, which was stability, a house, and education. The rest of the stuff kind of like slid by the wayside. We don't have to. My mom and dad went out of their way to put us down because they didn't want conceited children, and failed to recognize what the impacts that had had. So I agree with everything that you're saying. And recently I was at a nail salon and I saw a little girl trying to engage her mom, who was on the phone, and she just ended up biting her finger, walking away, looking at the nail polish, but completely disheartened. I totally agree with you. So one of the things that I heard you do a lecture, and you talked about how the impacts of early childhood trauma on children under the age of 1, long-term effects of trauma under the age of 1 are different than the long-term effects of a child who's had a somewhat stable environment up until the age of 1. Can you go into that a little bit?
Yeah, we just published a paper where, let me back up a second and just sort of set the context for this. So I'm part of a big network of clinicians and who are using a certain assessment model that we developed that allows us to look at the timing and the nature of adverse experiences. And so the categories we look at are sort of the intrauterine period, the first 2 months of life, the first year, up to age 3, and then 3 to 7. So we basically parse out the life cycle. And we look at we rate the number and the nature of these bad experiences and the severity, but we also measure the presence and the quality of relational buffers. So we have sort of these two elements. One is sort of related to things that we know are resilience building and kind of stress buffering, like connection to family, connection to community, connection to culture. And then we measure these bad things. And because we've been training people to use this for a while now, we've got about 45,000 cases, and all assessed in the same manner, all with acceptable fidelity, because we have twice a year, the people that use this model kind of have to take a test to make sure that they're scoring the same way that we score. And so we've just started to look at some of the outcomes from these data. And one of the things that we've seen was, again, if you know the biology of the brain, it's not that surprising. But when you actually see it clinically, it's pretty striking. So basically, what we've seen is that if you're a child and you have low relational health, you have no relational buffers or minimum, and you have lots of adversity in the first 2 months of life, and then you get into a pretty positive environment for the next 12 to 14 years, your outcomes are worse than if you had 2 months. The first 2 months of life were low adversity and high relational buffer. In other words, the first 2 months of life were pretty good.
Right.
And then for the next 14 years, your life fell apart and you had high adversity, trauma, bad things, and relational poverty. Mm-hmm. So when you think about it, really you're looking at 14 years of crap.
Right.
After 2 months is not as destructive to the developing brain and the developing child as the first 2 months of life being terrible and then having 14 years of goodness, which is a very powerful finding if you are thinking about prevention and early childhood policy. And it really supports the findings of people that have seen these really good outcomes with high quality home visiting programs.
Is that because the brain is developing so rapidly?
Well, I think there's two things. One is that if you think about the brain as this upside down triangle, right? We have these really important regulatory networks that are really low in the brain, and then they over development, as your brain sort of goes like this and gets bigger and bigger and bigger and more mature, mm-hmm. These systems play a major role in that maturing process. Right. And so, but what happens is in utero and in the first months of life, these systems are becoming organized. Okay. And so if they organize poorly, mm-hmm. It doesn't matter if later on you get into a good environment, they're still going to send these dysregulating signals to the rest of the developing brain unless you have a very developmentally appropriate intervention. And so I said there's two things. The first thing is, yes, it's because it happens when the brain is going through this very rapid, very important developmental phase. Mm-hmm. But the second thing is this, and this is important to hear because it's not as bleak as it looks. Right. The population that we've looked at this is largely kids that are from the child welfare system and other related sort of public systems where the schools that they went to, the foster parents' homes they went into, the medical community that treated them were by and large trauma uninformed. Okay. And so I'm convinced, and I know, and certainly we've seen this, if you take kids that are coming from these bad environments in the first 2 months, mm-hmm. but then put them into a developmentally aware home mm-hmm. where the parents are taught about neglect and trauma and attachment, and then the mental health, the pediatric and the mental health supports also know about this, mm-hmm. and the school knows about these things. If they're all sort of developmentally informed and trauma informed, the outcomes of the kids are fine.
Wow.
And so this speaks to the importance of engaging and educating our systems. And that's a big part of what we've been trying to do in our work over the last 30 years.
Yeah. It's working. It's working.
Well, we see progress.
Yeah.
We see progress. Yeah.
I'm happy with that. I mean, that's awesome. At least you're identifying the problem and you're addressing the problem and creating solutions.
We're trying, and we keep learning. It's human beings are complex, right? And there are so many factors that go into getting any given person to the present, the way they're functioning. There's all kinds of things that have played a role, and so we're trying to figure out, what are the most important things that we can do with our limited resources. Right. We're trying to figure out, is it more effective if you're in a mental health system mm-hmm. to spend an hour teaching the parent about this stuff right. or trying to do therapy with the child? Mm. And what we've realized is that the modern trauma-informed therapist really should start to think of themselves as the conductor of an orchestra rather than the person that plays every instrument.
Love it.
Because, what we know about how the brain changes is that it changes with repetition, tiny little experiences again and again and again. And so the people that are really making the therapeutic difference in the life of the child are the parents and the teachers and sometimes peers and after school programs and, what other people in the community. And so if that therapeutic web understands these issues, that means day in and day out, the child can have dozens and dozens of positive interactions, as opposed to just going to once a week, going to an office where somebody understands this and they have 5, 6, 7 positive interactions. So we're trying to, change the frame of reference of particularly doctoral level clinicians who may be really great, but the reality is you can be the best clinician in the world, and if you see somebody once a week and they're still in a home and in a school that doesn't understand them, you're just going to be, it's like, trying to swim upstream. You'll put a lot of energy into it and you won't make much progress.
Right. It's amazing. Well, I applaud your efforts, that's for sure.
Thank you. Thank you.
Well, hopefully this will help. I really do believe that there's an advantage to teaching making as many parents and adults aware of child's trauma.
Yeah.
And I've had grandparents say, "I watched your video and I never understood how this may have affected my grandson. Now when he walks in, I shut the television off, I put my phone away, and I make a big deal when he walks to the door." Fantastic.
Yeah.
See him, validate him.
And those moments are so powerful when even if it's like 2 minutes, even if the child feels that in those 2 minutes, Grandpa loves me, if he really feels you present. Grandpa could say, if he's sitting watching the game and his grandson walks in after school and he says, "I love you, good to see you, how was school, great, whatever." It doesn't feel the same as, like you say, turning off the TV, getting down in space with him, spending that moment with him. That lasts. I mean, those moments last.
Yeah, I think it's awesome. The people in my life, I had a few interactions with teachers that I felt saw me. It actually freaked me out, to tell you the truth. Like, you see me at first, because I was so used to feeling invisible. But I never forgot them. They were profound.
Yeah.
And so it absolutely is true what you're saying.
Yeah, no, I had the same experience that you literally, most people can think back on whether it's if they were in sports or theater or school, you can think back on the 1 or 2 people that really were present with you and like you say, saw you.
Right.
And there were other people that you could just tell they were just checking the box.
Yeah. Yeah. And it's a terrible feeling. And I think what hurts children, what's innocuous and a lot of parents don't appreciate, is you're in the kitchen, but you're not in the kitchen. Right. You're on the couch, but you're not in your body. You're dissociating. You're worried about an issue. You're codependent, or something else is going on. And this little baby knows it.
Right.
And fortunately, it reads like there's something wrong with me.
Yeah.
I'm not good enough because I'm not good enough for you to attune yourself to me.
Yeah.
So it's profound when someone sees you. So can you explain what a sensitized stress response is, and how even new helpful information can be perceived as a threat in a young traumatized child's mind?
Yeah. So, these systems that I was talking about that are down here, they're kind of the backbone of the stress response. And they're involved in sort of regulating and modulating a whole bunch of other functions in the brain and in the body. And so when they function normally, you kind of have this synchronous and very effective integration of function between a thought and a feeling and a behavior. And, most of us are pretty lucky that that's kind of the way we're put together.
Right.
But if you have a pattern of activation of the stress response where it's activated either in extreme ways or in ways that are kind of unpredictable and chaotic, like I said before, that it doesn't have to be this big, overwhelming thing. It just can be a pattern of chaos. That leads to the system becoming increasingly sensitive. So for a relatively minor challenge, you can have a huge reaction. And anybody who's worked with kids that have sort of been exposed to trauma, that's kind of the hallmark of their functioning, that they have meltdowns over the littlest things. They have difficulties with transitions. Sometimes when you're trying to get them to do something, they act like almost like you're trying to hurt them or something. It's like it feels illogical to you. But to the brain of the child that has been sort of inappropriately overactivated, the system is basically turned on a state of fear in a semi-permanent way. So these kids literally walk around every day, even though there's no external threat. Their brain is telling them that they're under threat. And so they use all kinds of maladaptive behaviors. It influences the way they process cognitive information, shuts down important parts of the cortex so that it's harder for them to learn. It's harder for them to retrieve things that they've already mastered. And so these kids have struggles with school. They have struggles with social interactions with peers. And one of the hardest things about this is that your brain basically treats anything new as a potential threat. And now so it doesn't, if you are neurotypically organized and you're exposed to novelty, like let's say that most people probably have had this experience that they decide that they're going to go somewhere for a vacation. And they go through all the hustle and bustle of getting through security and getting on a plane and going to a new city and getting a cab, and everything's kind of new. And you get to the hotel and you feel exhausted. And it's because you're even though you're doing something fun and you're doing something you want to do, it's novel, it's new. And so your brain basically keeps you more tuned up than you would normally be. And that's exhausting. But if you had a sensitized stress response and you took a child like that on that holiday, they would have meltdowns about going through security. They would have meltdowns about where they sit. They would be, they would be overwhelmed by all of this because their capacity to tolerate new things is so narrow. They've got such a thin margin between what their baseline is and what their meltdown point is. Right. Whereas you and I have a bigger space. We go, when we have this much novelty from a vacation, we go from being calm and mellow to being sort of alert and tired out at the end of the day. But the child who starts here and has this much margin, and you go on holiday, you put them into a state where they're overwhelmed and they melt down. And that's kind of what sensitization is. The sensitivity of your stress response is changed.
This is really important for parents to understand, for teachers to understand, for pediatricians to understand, for anybody that's involved with the child, that these meltdown responses. My stepdaughter is a teacher over in Connecticut, and sadly they removed a child on Halloween on a stretcher. He had such a meltdown that they had to call an ambulance and have him taken out of the school building. And it's difficult to comprehend and to reconcile when you understand that this is a sign that this child's in trouble. There's something that is ongoing and is happening to him or has happened to him. Yeah. I think it's so important that as many people as possible understand that these types of responses are a cry for help. Because very oftentimes children are treated in the not nicest of ways when they're having a meltdown. They're not understood. Right. We're expecting these very limbic and traumatized children to have emotional control. Right. And it's physically impossible.
Exactly. Yeah, that's, one of our most important initiatives in our organization is to try and help both parents and educators understand these core concepts about the impact of developmental trauma. Because just as you say, behavior is communication. The behavior, there's something that is not right. And, it's interesting. All too often, our solutions to those behaviors make them worse. We marginalize, we're punitive, we ourselves get angry and frustrated. And so it just leads to this cascade of, mess. And the good news is that when you take educators and you teach them a little bit about what we call state-dependent functioning and a little bit about the trauma responses, they themselves go, oh, well, if that's true, then maybe I shouldn't threaten Billy when he's starting to have a difficult time. Maybe I should actually take a step back, lower my voice, give him a little bit more time. And you're like, that's really a good idea. Now that you say that, yeah, you're right. Yeah. And when that happens, the restraint levels and the critical incident levels at schools just plummets. And again, we just published an article about this this year. And we have a lot of other data from other places that work with us where, the simple introduction of these concepts to a school leads to a dramatic decrease in referrals to principal, in suspensions, in critical incidents. And the teachers want to teach. They hate it. They feel terrible when this happens. And so what will happen is that the teachers enjoy being at school when it's not as dysregulating, and there are fewer teacher sick days. There's less teacher turnover. There's higher teacher satisfaction. And so you get this incredible virtuous cycle where the teachers feel better, and because they're the dominant individuals in the classroom, the students feel better. And you get this co-regulation that leads to much better learning and much better academic outcomes and much better behavioral outcomes.
My stepdaughter actually has a common corner. She's a kindergarten teacher. And so she has a little corner. And we've talked a lot about trauma, she and I, over the years. So she understands.
Yeah.
She has a little rocking chair. And she has a little blanket. And she has little animals there. And she has, little smiley faces, little emojis. Right. And when somebody's upset, she says, "Are you upset?" "Yes, I'm upset." "Okay, there's the common corner. Go ahead. You can go sit in the common corner for a little while." And she says time after time, the kids go sit down. They label the face, which represents their feeling. They sit there for a little while. They feel validated. They feel seen. They haven't been chastised. They haven't been punished. They've been appreciated for having this experience. And then they slowly join the group again. It's absolutely fabulous.
Yeah, and that's such a great thing because there's a couple things that are really important about interacting with a dysregulated person. Number one is that you give them control of the process. That you can go over. Do you feel like going over to the common corner? Yes. And then they go over, and then they can make multiple choices about what they do to regulate themselves. It might be sitting, and they may be curling up with a blanket. And so they use their own self-regulatory preference to kind of get back to a baseline where they then, without shame, are ready to integrate back into the group. It's a really nice way to do that.
Yeah, and then they're welcome back. Welcome back, Billy.
Yeah, that's great.
It's beautiful. There's no shame, no nothing. So is there anything that you can leave us with that you think is important that the everyday person or the mom or the dad that's watching this video,
right?
What should we know about childhood trauma, and how can we help?
Well, here's the most important thing to know. And I know there's been a lot of talk about ACEs and adversity and how that increases your risk for all these bad things. And that is true. But what is equally true is that your history of connectedness is more powerful than your history of adversity. And so present connection to family, to coaches, to teachers, all of that stuff is able to buffer present stressors, and it's able to create an environment for healing for past trauma.
Awesome.
And so what's really important for everybody to know about this is that you don't have to learn a bunch about the brain. You don't have to take any special courses, but you should know this, that when you are fully present and engaged with the child and trying to understand and listen, and when you're nurturing to them, you literally are creating therapeutic moments for that child. And healing doesn't come from one 45-minute dose a week. It comes from hundreds of 5-second long moments throughout the week. And the people who provide those 5-second moments are mostly parents and teachers and friends. And as we were talking about earlier, it doesn't take that. You don't have to, think about yourself as a therapist. You don't have to worry that it's going to eat up all your time. But if you're fully present, just for a moment, just for a minute, 2 minutes, that is really, really a powerful thing to do. And of course, the way if coming in and out and dosing and interacting with your child throughout the course of the day is optimal. And so the real positive, hopeful message is that you as a parent, you as a teacher, you as anybody who interacts with children are actually a vehicle of positive change. And your capacity to be present, attentive, attuned, and appropriately responsive really is going to be therapeutic for that kid.
It's so awesome, Dr. Perry, because it's not that difficult.
No, it's not. It's not. I mean, it's, obviously when these kids are struggling, it's confusing to figure it out.
Yeah. Yeah.
But, even the worst kid has basically 85% of the time, they're not having a meltdown.
Right.
And so in all those other moments, you can basically provide these little healing interactions that are regulating, that are rewarding, and that are going to transform that child's brain and make them less sensitized, which means that the number and the intensity of these meltdowns will start to go down.
So it sounds like parents, let's say parents have had a difficult time raising a child. It sounds like parents have to get out ahead of it.
Yeah.
Instead of focusing on what you don't want, we have to start focusing on what you do want. We have to start focusing on just being present. And because I think oftentimes when we have an issue with the child, we tend to focus on that issue.
Yeah, and we overtalk it.
Yes.
We overtalk it. And it's like, you know what? You're never going to figure some of this stuff out.
Right.
Just, it happens. And there's no reason, a lot of times, there's no reason that you can figure out. Sometimes you don't know their evocative cues.
Right.
Most times.
Right.
And so and don't put that burden on yourself.
Right.
The real key to all of this in the end is if you're regulated,
right.
If you stay calm, if you take a step back and count to 10 and calm yourself, you'll be able to use the power of relational contagion to interact with the child in a way that can help the child calm down. But this is why self-care is so important. This is why, respite is important. This is why it's important for overwhelmed parents to do stuff like go to your book club, go exercise. It's impossible for a dysregulated adult to regulate a dysregulated child.
Absolutely.
And so these moments that I'm talking about can only occur if the adult is regulated.
Amen to that, Dr. Bruce Perry. And that's what my channel is all about, it's all about self-awareness and accountability and getting yourself in check and regulated so that you can be a powerful force in not only your life, but the life of your children and your grandchildren and society at large. Because I think in order for a society to be more regulated, it has to start with little groups of people first.
Exactly.
And then it can transmit out that way. You've been a wonderful, wonderful guest, and I cannot thank you enough for being here.
It's my pleasure. Thank you for having me. Keep up your good work.
Yeah, thank you so much. And I'll send you guys a copy of the interview as soon as it's all edited.
Awesome.
Thank you so much. You too. Keep up the good work. Bye.
Bye-bye.